Welcome, everybody. Let's get started. We're going to talk about anxiety, stress, and depression today, and how cannabidiol supports all of those things. So anxiety, stress, and depression are common problems that we encounter so much. The magnitude of this problem is absolutely huge. So a great deal of difficulty. People are doing quite a bit of suffering with this. So I want to tell you about a little bit about what we're going to talk about today, the social and economic burden that we're encountering, as well as the current treatment strategies that we now have in place. We're going to talk about some of the causes as they have been classically depicted, as well as the endocannabinoid involvement and how it relates to these three conditions. And then we're going to talk about CBD treatment action and what CBD can do for people who are in these situations. We're also going to look at who should be using CBD, the downsides, and also look at a quality CBD product, what you can look for. And then if you want to find out more about CBD, then I'll give you some references for doing that. So in the first place, the social and economic burden of these particular problems, whether it's stress or it's anxiety or depression, is absolutely huge. Now, my concept is that this is a continuum. It's a spectrum of disorders that comes together. And we think of them, oh, these are all separate. But in fact, they're probably different levels of the same problem that's going on. People talk about all the time of, oh, gee, I'm under a great deal of stress. Oh, well, what does that stress do to? What's causing it? I think that our environment now is certainly loaded with potential problems in terms of competition that's occurring within our workplace, within our sports, as well as the crowds that we're encountering in larger and larger groups, as well as terrorism, the news of all places, and entertainment. It's appalling to see the number of violent films and movies and reality shows that are going on a regular basis. And that includes kids and cartoons as well, where they're encountering quite a bit of trauma and issues of potentially great stress that occur in those situations. Now, if we're looking at costs in terms of anxiety, we're talking about $42 billion, and that's probably a lowball estimate. About half of that is actually attributed to costs that are not directly related to anxiety. So people go to the doctor's office or they get hospitalized because they are anxious and there are other problems that they may manifest, or other difficulties, or even accidents that they might be involved in. So it's not necessarily the treatment for anxiety. In addition, there's at least 40 million people with this condition. And it's said that as many as 15 to 20% of people have this condition over their lifetime. And then if we move on to depression, we're talking about even 4-5 times as much as $410 billion. And the numbers that people who have depression probably range in the area of about 15% over their lifetime. So it's a highly prevalent condition. And I think that we may have been misled in terms of the causes of it. I think there are a lot of ideas about what causes it, but I think let's take a look at some of the classic as well as some of the concepts that are involved here. First off, we generally think of stress as being maybe the leading thing that sets things off and takes us to anxiety, and then with anxiety long enough, or it's a separate entity, that it's depression. As I said in my opening piece, I was talking about this being really a potential for a continuum, a spectrum of disorders that is really manifesting in very similar ways, but at different levels and actually different degrees of symptomatology that people have. Now, classically, if we're under stress, we approach that with, oh, well, I just need to relax, or I need some social interaction, or I need to improve my sleep quality. And when you do those things, supposedly the stress goes away, you're able to relax greater and more. also, when we're under stress, it's pretty clear that the hormones go kind of crazy. That's frequently talked about, especially cortisol and adrenaline, the fight or flight substances that our body circulates, as well as the physiologic changes that go on that are that reflect those hormones specifically. The rapid pulse, the sweating, the wide-eyed stare, and the looking out, and the nervousness, as well as the difficulty sleeping, and tension and irritability that goes along with it. And then we also, those are the common entities and common things that we talk about. But one of the ones that we're just now discovering and realizing how important it is inflammation. Now, and inflammation can be reflected in the cytokines, those inflammatory substances that the immune system produces to stimulate protection, to harbor protection, and to provide induration or protection to the area, and bring in and recruit immunizations to those areas. However, in what we're seeing, though, is that with this type of release of cytokines, it is very closely associated with anxiety and depression. In fact, there are studies that show that the release of cytokines without any other stressors can lead to anxiety and depressive sorts of behavior. So there are specific models that are inducing these types of depressions and these behaviors as a result of inflammatory cytokines. In addition, there's evidence to show that in current literature about anti-inflammatory drugs like non-steroidal anti-inflammatories, we're talking about Motrin or naproxen, acting as antidepressants. Not only the antidepressants that we know and love, the SSRIs and such like that, but just plain non-steroidal anti-inflammatories have a role in decreasing depression. And probably the mechanism has to do with inflammatory processes. Now, in addition, this was very interesting that combat training for soldiers actually pushes levels of stress up to the level that it increases the cytokines and immune activation, but it also increases the blood-brain barrier permeability. So that means those cytokines and those inflammatory substances can penetrate to the brain and provide more inflammation and more signaling to the brain that could lead to anxiety and depression and maybe PTSD. So if we're looking at the current treatment for anxiety, stress, we mentioned some of those things earlier, but the main focus of depression and anxiety is behavioral. The idea is to use counseling and orientation to help people with things, to deal with situations, especially when they're not entirely rational. A lot of what we've thought about stress and anxiety and depression is that it's situationally related. So somebody died, you've had a failure or a loss of some kind, and certainly those things are important, but it may be that the inflammatory connection is a stronger mode. In any case, behavioral therapy can be one of the leading things like cognitive behavioral therapy for the treatment of depression and anxiety. Of course, going into most doctors' offices, the first thing that comes up are one of the drugs, and we have a multitude of different drugs that are being used, whether those are tricyclic antidepressants or serotonin reuptake inhibitors. There's a full range of those drugs. Unfortunately, like all drugs and all substances that we put into our body that are artificial, there is a potential for having significant side effects. And a lot of people do have the side effects, and that's regrettable. In addition, we're also talking about lifestyle changes. So we know very clearly that lifestyle changes make a difference, whether it's exercise, quality rest, relaxation, improved sleep. All those things definitely make a difference and are helpful for relieving stress and depression, but they are not always complete in and of themselves. And then more recently, of course, we have the complementary and alternative approaches that use prayer and meditation. Maybe it's osteomanual manipulation, what the chiropractor or the osteopath does, or even acupuncture. Those things do have a role, and they can play a significant part in the treatment of depression and anxiety. So let's tie in the endocannabinoid system, because I want to talk about how this all relates. A lot of those things that we were talking about in those therapies are actually endocannabinoid enhancers. And so they're making adjustments in the endocannabinoid system. Just a quick review that our bodies are fitted with an entire system of cannabinoid or endogenous cannabinoids that we call the endocannabinoid system that really regulates our hormones and our immunologic function, as well as a number of inflammatory mechanisms that are going on throughout the body. And it's located everywhere in every organ system, but there's a big concentration in the brain specifically and in our immune system. Those are the two main areas. What we're seeing, and I want to make the connection with the endocannabinoid system and the anxiety and the depression that we're seeing around us. First off, there's a huge link and connection with the endocannabinoid system between that and the immune system, as well as the inflammatory cells that are out there. So in many of these diseases and conditions, specifically anxiety and depression of several different types, we're seeing changes in the endocannabinoid system, specifically a lowering of the endocannabinoids, the amandadine, as well as the 2-AG, whereas we're also seeing very high levels of cytokines, which is consistent with that inflammatory theory that are also going on. In addition, there are changes that are going on in the endocannabinoid receptors as well. A perfect example occurs in PTSD, where we see a very large increase in the number of receptors, but a great decrease in the availability of the endocannabinoids specifically. In addition, we've got evidence that in these particular disorders, the anxiety-related disorders, that there is a decrease of the behavior when using certain types of endocannabinoid receptor antagonists. And specifically, that was used for one particular endocannabinoid receptor, and that's the TRPV. That's the transient protein receptor vanilloid, and that's the particular one that's what I want to make a point of is that this is not your CB1 or your CB2 that commonly we think of in terms of cannabinoid receptors, but one that is very specific and is not really activated by the usual endocannabinoids. And that's where some other substances and some oils and some phytocannabinoids can play a role, as well as other substances that would come from the pharmaceutical industry. In addition, we've got evidence that acute stress increases the circulating levels of anandamide in some situations. So we're seeing other studies that are showing variations in the endocannabinoid system that give us the indication that there is disturbances that are going on both with respect to inflammation as well as the endocannabinoid system. And finally, there is clear evidence that cannabidiol is an anxiolytic drug, as it was used in human studies to extinguish social anxiety disorders. So really good news for the use of the phytocannabinoids, probably working through the TRPV receptor and making its effect well known. So where does cannabidiol fit into this story? Now, first off, we've got cannabidiol is restoring the endocannabinoid system. So it's helping it to recover, and it's rebalancing both the receptors and the endocannabinoids, so bringing them back into balance. And so rather than having high levels or one or the other, it's balancing them, modulating them, and returning them to normal. In the neurologic system, we have evidence that cannabidiol specifically handles and provides treatment for and alleviates pain, anxiety, as we've talked about, improves the mood, improves sleep quality, mental fog. And here's a really important one that makes a very good connection for some of the stressors that has to do with the blood-brain barrier in terms of firming up those connections in the blood-brain barrier to decrease the amount of inflammatory substances that are coming into the brain and as well as toxic substances that could lead to inflammation of the brain area. In addition, we've got the gut function where it's blocking or it's improving leaky gut and decreasing the motility, decreasing inflammation, and the elimination. And I bring that up about the gut because the gut is so often involved with these anxiety disorders. A lot of times we have a lot of gut symptoms and irritability, as well as leaky gut syndromes that seem to increase or be related, at least in a large part, to the anxiety, depression, and the gut symptomatology and irritable bowel syndrome. And so all of these things tend to work together. And if you look at migraine, you know that one of the prominent symptoms of migraine can be nausea, vomiting, and disturbed stomach. So these things do make a connection. We already talked about the immune function, and CBD is taking a direct action on the inflammatory cytokines, as well as the immune cells and decreasing the number of immune cells. It's working on the adrenal hormones, particularly cortisol, and rebalancing them. A lot of people want to say, well, is it raising or lowering? It's balancing them because depending on the situation, you may have higher or lower levels of cortisol or reactivity. So just think of cannabidiol as balancing those things, normalizing it, and returning the body back to a homeostatic level. And finally, and specifically, CBD is working on reactive oxygenation species. And those are inflammatory molecules that are going on inside the cell. So this is intracellular action and even intranuclear action where we see changes in the methylation and enhancement of the methylation so that function within the nucleus is taking place, as well as work on the mitochondria itself and restoring and balancing the mitochondrial function. Well, with all of these excellent approaches, how can you use cannabidiol to treat these particular problems? Well, I find cannabidiol is very effective at treating anxiety and depression, and I like the best approach is using the liposomes. I find the liposomes work very well, have an increased bioavailability and absorption, and go straight to the brain very effectively. I like people to hold it in their mouth and have it go through the mucous membranes, but the bioavailability and the taste factor make this easy to use and highly effective. If you're not able to use the liposomes, then the alternative is the capsules or tinctures. And at that point, I try to use 15 milligrams twice a day as a pretty standard dose for most problems. Remember too, if you're using the cannabidiol, make adjustments, make them early. If you're not seeing a response immediately or very soon thereafter, you want to make adjustments, increasing the dosage, finding a level at which it is effective. Because in 99% of the time, I find that this is quite effective for restoring balance and relieving the psychic pain that people have with the suffering that they're going through with the anxiety and depression. It's fabulous to see people change right before your eyes and have a relaxing and calming experience as well as an improved mood. Such a relief. I don't know that there is anything that provides such a level. In fact, antidepressants can take up to 3 or 4 weeks to work, whereas with the cannabidiol, you can see the response within minutes. If you're using cannabidiol, remember there are several different routes. You can use it orally, sublingually, or even topically. Topically it takes a little bit longer. You don't get necessarily the levels, but it's an alternative for people who are reluctant or cautious and not feeling like it may be the best approach for them. In addition, you're looking at the duration of action on the order of 6 to 12 hours. So 2 or 3 times a day is pretty good for taking care of the problem in managing it, but everybody's different, so you have to adjust the doses according to their need. Well, who should be using cannabidiol? Well, I envision people who have symptoms that are unresponsive to those usual measures, those lifestyle changes, to the dietary things, and maybe some of the manual therapy that might be involved with that. If they're not getting better with those, you got to think about CBD being recruited to help them restore their endocannabinoid system and rebalance. If they have inflammatory diseases or disorders, then they're at high risk for having depression and anxiety. And it doesn't matter what age it is. I think that this is a very effective medication. And the other things that are out there for anxiety and depression and stress are really have so much side effects that I would consider them somewhat dangerous and risky, a lot less so for CBD, because CBD doesn't have any side effects and it doesn't have any toxicity. In my experience, I've seen that CBD has been particularly effective for PTSD, people with brain injuries, and all types of trauma. So I just want to remind you that I don't see adverse effects to CBD. I don't see any toxicity or any drug interactions, and there's no coagulation effects that, in my experience, no one has reported them. I haven't seen them. It's not in the literature. And then let me just go over, and I'm going to recap here about what we've talked about in this brief presentation, and that is that stress, anxiety, and depression are part of a continuum that are closely associated with inflammation and the endocannabinoid dysfunction. If you restore the endocannabinoid system, you're going to restore the body and you're going to help people recover. The current lifestyle and medical therapies that we have do enhance the endocannabinoid system, but they're not always enough to bring people to a level of health and healing. And finally, CBD supports, protects, and enhances the endocannabinoid system. So it has without toxicity and without adverse effects. So I think it's an excellent agent for to use, and I think it could be quite valuable in your practice. And I want to highly recommend that.